Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to all of you joining us here today. We are talking about our up and coming Gold Lactation Online Conference 2021. And of course, we're interviewing all of our speakers. We have a very special guest here. Oh my, I can't wait to share what she's talking about. But first of all, I would like to introduce to you Dr. Smaranda. Welcome, Smaranda. It's great to have you here today.
It's good to be here today. Hi, Fiona,
Well,
and everybody.
we've been having such a good time together because we've been talking about something that both you and I are very passionate about. But before we get into that, would you share a little bit about, first of all, where are you in the world right now?
I'm in
And
Romania.
in Romania,
Far away. Romania,
far
Bucharest.
away from me, but you might be
Yes,
close to some others. So it's great to
yes.
have you coming from Romania. Tell me a little bit about your practice in Romania and what do you do there?
Well, I'm currently on maternity leave because I have a little girl and we're having fun together. So I'm more or less a stay-at-home mom and maybe work from home mom,
Hmm.
online, of course. And she's 8 months old
Wow.
now. Yes, so it's a great experience to apply everything that I've learned so far in my life. And I can tell you, you can know everything, you can study everything, and there is not one day when I don't make a mistake and I say, I know this should have gone differently and couldn't help it. So there is no perfect parenting. Good to know. So this is what I do right now, and I hold parenting classes and I teach parents how to talk to their babies and breastfeeding counseling, and more or less this is my job right now.
So are you still actually currently doing those classes right now while you're on
Yes,
maternity leave? Yes.
yes,
Yeah.
yes,
So you're really working multiple jobs still.
yes.
But I know that you really love what you do as well. So when you go back to work, what will you be doing or how will things change for you? Do you know yet or have you not made a plan yet?
I haven't made a plan. What I used to do is that I've been family doctor for 4 years, so I had a lot of patients, and then
Mm,
I moved towards breastfeeding counseling and psychological counseling and personal development programs. So I suspect I will go towards personal development programs because that's where my passion takes me so
right.
far, and I have three different directions of I don't know, of study. So I've
Hmm.
studied medicine and psychotherapy and lactation consultants, and they all fit together perfectly. So I'm making this mix up and I'm using it in everything I do.
Yes, well, I can tell because every time I talk with you and we start talking about your presentation, that it sort of manifests into something bigger and greater. Like there's so much more to this. We've got to do more.
Yes.
So I know how excited you are to share some of these concepts with us. But I see that this is just evolving all the time, and I think even for me, it's something that I've also been very passionate for a long time about as well. So let's talk about what's going to be coming up and what you are going to be talking about. Because now that we've talked a little bit about it, we don't want to keep folks guessing. So your presentation title is "Talking to Babies: Basic Communication Skills for Lactating Parents and Healthcare Specialists." So, Smaranda, tell me a little bit about what we should expect from your presentation. Some of the highlights that you're looking forward to sharing.
Well, actually, it all started with something that I thought was more or less paranormal activity. So, when you try something and it works and you have no explanation for it. So that was my first case many, many years ago. And what I have discovered applying this method and is that if we talk to babies and if we explain to them when something stressful happens, and if we explain to them that something happened and what it was, and that they are safe and that we take care of them and that they can relax even though they were stressed out, they will start slowly, slowly to relax. and then overcome that stressful event. Now, when we talk to breastfeeding babies, one of the first signs of stress is the fact that they stop breastfeeding well. So they breastfeed less or less effectively, or so we have babies that breastfeed perfectly and then they just stop.
Mm,
So these are the cases that I will bring into
mm.
discussion. And I will also bring, of course, evidence-based medicine, because it's not paranormal activities. There is no miracle, or maybe there is a bit of miracle there, because we're talking about babies and parents.
Yes.
But I have proof. There is evidence. There is also a mechanism behind all of this, and I will also bring that into discussion. But it all starts with nothing short of a miracle.
Well, I believe you, because I too, I love that, the idea of being able to find those very subtle situations, because I think that there are so many things that we do right. There's so many things that we do right as lactation consultants, and what we're passionate about, where our counseling skills and our clinical skills that we bring to the table. But the translation of making it all work and the subtle behaviors with our infants and our families really can make or break it for a lot of those situations. And so for me, I am so eager to always learn, especially from folks like you, Smaranda, just to look at everything again, analyze how it is all put together and why some of these situations seem to work out really well and others don't. So I'm hoping that you will bring some of that as well, so that we can share together in some of those experiences.
Actually, I will take into account how our bodies show what we feel and what we want
Mm,
when we build communication, because communication actually is not made so much through words, but through how our bodies behave and how our bodies move and shape themselves during communication. So we might do all the right things, but if we don't have our inner world aligned with the outer world, the message will not come through properly. And this is where disruptions happen.
mhm.
So we will approach that in the presentation as well. We will talk about intention and attention.
Yeah, well, that's perfect, because I think these types of things you can take into all different types of scenarios in all walks of life. So even when we're working with clients, or perhaps if we're teaching students, I think there's many aspects that we can take, prenatal clients, babies, all sorts of different scenarios. So I will be listening intently to learn more on how I can utilize some of these skills that you're going to be sharing. So thank you so much. It's been so lovely having you just share a few little things about what's going to be coming up at our conference.
Thank you as well. Bye.
And once again, I just want to mention that Smaranda is going to be talking about talking to babies, basic communication skills for lactating parents and health care specialists. Now, you can join Dr. Smaranda Ney at our conference live, which is going to be fantastic. So she will be here. You can go online and check out all the details of when she's coming up. And of course, we've got all of our schedule available for you right now at goldlactation.com. And if you did want to drop a question or a comment down below, you can do that right now as well. We'd love to pass that along and take it into our conference as well. So do join us in all the conversation that's going to be coming up live at this event. Of course, all of our sessions will be recorded for your convenience as well. Thank you so much once again to Dr. Smaranda Ney for being with us here today. And of course, to all of you, our viewers, have a wonderful rest of the day, everyone. Bye-bye for now.